Welcome back. Cholesterol Awareness Month. Very hot button topic for so many people.
Exciting. I love it.
It is. And as we continue to try and learn more about it, we've got Dr. John Lepre joining us. This is part 2. So we're talking about, well, unfortunately, the southern states. and it tends to be an issue.
I have a map. The southern states just light up with rates of high cholesterol.
Yeah.
And with that goes the high rates of heart disease and stroke. They just go hand in hand.
Okay.
So there we go.
There we
it's
go.
very common, and it's very dramatic, actually, if you look. It just lights up exactly where you think it'll be.
Wow. I'm trying to see what else is like. What's below Ohio there? Okay, wow.
An added fact, about 10% of all adults have high cholesterol. This is a very common issue.
Right.
It affects about 25 million adults in the United States. Quite a bit.
Okay, so where do we go from here? Where would you like to?
The good and bad cholesterol.
Right.
So everybody talks about that.
That's where it gets confusing for some.
Yes. And it's simple to measure. It's just a simple blood test. And what you'll get is a total cholesterol, and a good cholesterol, HDL, and a bad cholesterol, LDL.
Okay.
Now let's start with the good. The good cholesterol removes all the other fats, and you obviously want that higher. So we recommend exercise and diet changes to improve your good cholesterol.
Okay.
Bad cholesterol, that's the one that builds up in the arteries. Obviously you want that one lower, and we're going to recommend diet changes and medication for that. So medication, that's the hot button. That's the one.
I just had both of those.
Oh.
I needed this beforehand, so I knew what HDL meant and stuff. I'm like Googling it. But no, that's very, very informative there. And also, I'm sure the exercise goes a long way too for both, right?
Absolutely.
Yeah.
HDL, there's not much you can do to raise that, right? There's no pill for that. So you are down to exercise. Being female helps. Their levels are actually a little higher than men. It's an estrogen effect.
Well, I know we are going to send it to Adam here in a second, but this is a topic of discussion we are going to continue, correct?
Absolutely. This will be a series. I'm really happy to bring this.
I am super excited about it. I'm sure our viewers are as well. Adam Olivier, we send it to you for a check of the weather.